Let's move on to the other side. We will not present it anymore. The way we worked, one side we will work the other as well. After finishing both sides, we continue with the Petrissage, or with the kneading. In order to knead, we will wipe off all the excess oil from both our hands and Christy's back. There will be again a very important method of kneading, of squeezing. Here I want to explain more in detail as I show. We catch the crease. It's called Russian Petrissage. We catch the fold and don't leave it up. We catch the fold and don't leave it up. We divide the back in two in this case. If it was a bigger back, we would divide it in three. Divide it in two. The first time we work on the side. Catch the crease and bring it up. Then we return slightly with an effleurage to catch another crease. We've already come to the middle of the back and we're taking it up again. One more time. We squeeze. We squeeze the tissues. We cross to the other side. So don't forget your hand stays there, okay? Again, we take the crease and carry it up. It's a squeeze. What should I call it? It's an artwork. But now we're working with dough. And we take the dough as the housewives once did and process it. Right? So we do with Christy's back. We take a piece of dough and bring it up to see what pretzel will come out in the end. Good. After Petrissage follows tapping. The three types of tapping: hacking, cupping, pincement, beating, tapping. Caution, we do not tap the kidneys. Let's jump over the tapping with the cuticle part. Don't hold your hands as for karate. Keep them relaxed. You have to hear the sound. I first started learning tapping not on the pavement but on bed and pillows. That's how you can learn. Then tapping with the ladle. The thumbs is stuck to the forefinger and the hand is in the shape of a cup. And that's where the air is to come out. Again, it creates a sound, a certain sound. If your palm is too outstretched, then it sounds. It's not correct. The sound must be closed. Another tap with the fist. Again, it is not with clenched fists. We don't want to hurt. But we want to do a good with a half fist and alternate. Next follows an effleurage. We are now approaching the end of the story for this part. Okay? We'll perform a vibration, and this can be learned as well, or in the beginning you can do a light touch. We are covering the back. Next comes a maneuver that I learned from a colleague. It's called bear stepping. It's worth doing. This maneuver is also very good. Look, the bear walks on Christy's back. Good. We now have another portion. The neck, scruff, and the scalpel. We need to work on them as well. Applying oil again. Where? On our hand. And there we'll perform another effleurage. We start the story again from the beginning. A prayer type of effleurage, together with our hands as for prayer. We spread our little fingers and go from one side of the column to the other by the ribs. Then we climb towards the shoulder blade, shoulders and turning back to the cervical area. Now we will tie immediately. This effleurage is very good. Yes, don't forget the position. We do everything from the body, not from the hands. Look how beautiful. After we do these effleurages, we will work on one side also with an effleurage. On the neck up to the shoulders, after which we will perform a friction with the palm in the shape of the letter C, enlarging the lateral sides of the vertebra as much as possible. In the same place of the opposite side, we have to work both sides because otherwise we fail to explain everything we want. Friction. This apparent effleurage is also a part of the friction. A friction with the first from the nape of the neck to the shoulders. Then we will work the upper trapezoid a little by maneuvering over the muscles. Cross fiber. Supraspinatus. And the shoulder blade razor. We do it again on the other side. So the upper trapezius, the supraspinatus, and the shoulder blade razor. Here we will make another cross fiber. Above the occiput to the shoulder and the petrissage with 3 fingers. We don't have enough space to use the whole hand, but we have and can use a few fingers. 3, 4, as many as you can, okay? In the same way we take the dough. And now we're going to make a bagel. Early made a pretzel, a baguette. Something will come out. We continue with the occipital area. We use all our fingers. We look at the occiput bone and we go past it with friction, round from the base, to the side of the mastoid area, where we stop. We don't go any further. There are important arteries. Cardioids. We don't want to disturb them. And thumb stationary friction. So we stop from place to place and press and cross fiber friction. Also, this occipital area, patients really appreciate these movements because if they are stressed, if they are tired, if they have worked hard at the office, massage in this area of the neck produces muscle relaxation and decreases nervous tension. They feel very, very good. Then comes the scalp. We try to take into account the structures of the scalp, the occipital, temporal, and frontal parietal. Compressions with the palm of the hand, and that maneuver, the hairdressers, older barbers sometimes do. A little head massage after finishing the haircut. Quickly, just like that. And now we cover the patient completely.
Hey, thanks for watching this presentation. My name is Bill, and I'm the voice behind this video. If you've not already subscribed to our channel, please do so by hitting the subscribe button. You'll get a notification bell every time we upload a new video. And if it's not too difficult, give us a like as well. This ensures that we'll keep being able to bring you great content and you'll get to hear me more. Leaving comments is also appreciated, and it helps us to know if we're meeting your educational needs.